Imagine this. You're in your kitchen, you reach for a glass of water, and suddenly your right arm goes numb. Your vision blurs. Words come out jumbled. You're not dizzy. You're having a stroke, and you're completely alone. Every 40 seconds, someone in America suffers a stroke. Many live alone, especially seniors. And when no one's there to help, you become your own first responder. Most advice out there assumes someone else will call 911 or drive you to the ER. But what if you have to save yourself? This isn't just helpful information, it could save your life. Let's walk through 5 critical steps you can take in the very first minutes if stroke hits and you're alone. You'll learn how to spot the early signs, how to call for help when you can't speak, how to prepare for EMTs, and even how to position your body while you wait. Let's start now, because in a stroke, every second counts. When a stroke begins, your brain may not realize what's happening. You might feel confused, numb, or off balance. But part of you says, it's probably just fatigue. That voice can cost you everything. That's why the first step to surviving a stroke alone is awareness. Start with the fast test used by medical professionals around the world. Face look in a mirror. Try to smile. Does one side droop, arms raise, both arms? Does one arm drift or feel weak? Speech. Say a simple sentence like, the sky is blue today. Is it slurred or jumbled? Time. If any of these signs are present, act immediately. But there are more signs many seniors overlook: sudden numbness or weakness, especially on one side, trouble understanding others or forming words, sudden trouble seeing in one or both eyes, sudden loss of balance or coordination, sudden severe headache with no known cause. These symptoms might seem mild, but don't ignore them. Strokes don't get better on their own, and the longer you wait, the more brain cells die. So the moment something feels off, don't doubt yourself. Act. Call for help. Immediately. Now comes the second step, calling for help, even if you can't speak. This can be tricky, especially if your speech is slurred or you're feeling confused. But technology can work in your favor. Start with your phone. Use voice assistants. Say, "Hey Siri," or "Okay." Google Call 911. Emergency shortcut. On many smartphones, pressing the power button 5 times quickly will auto-dial emergency services. Use your medical alert button if you wear one. Smart speakers like Alexa can call contacts or trigger alerts if properly set up. If you're connected with 911 but can't speak clearly, say the word stroke as best you can. Even a mumbled or partial word can be enough. And if you can't talk at all, stay on the line. Many emergency systems can trace your location automatically. What if there's no tech bang on walls or floors? Someone nearby might hear you. Wave something outside a window, a towel, flashlight, or anything that moves. Try crawling toward the door or main entry, wherever rescuers are likely to look first. Remember, stroke care is a race against time. Even one finger on one button could mean the difference between recovery and lifelong damage. Step 3 is often overlooked but absolutely crucial. Make yourself easy to rescue. Once help is on the way, don't just sit and wait. Take action to ensure first responders can reach you quickly. First, unlock the door. If you can move safely, unlock the front door right away. In an apartment, buzz them in if possible, or leave the door ajar so they can enter without delay. Next, make yourself visible. Move to a main room or somewhere near the front door. Turn on porch lights. Open the curtains. Anything that helps them spot you faster. Gather essential medical info if you're able. A list of medications, allergies, conditions like high blood pressure or past strokes, your doctor's contact info, an emergency contact. Put this somewhere visible on a table or counter. Secure pets if you have them. A barking dog or frightened cat can block access or bite out of fear. If possible, place pets in a separate room with the door closed. Finally, clear the space. Push furniture aside. Roll up loose rugs. Turn off appliances, especially the stove. This creates a clear path for medical equipment and reduces hazards. These small actions could shave minutes off your emergency response minutes that matter more than ever. Now let's talk about what to do with your body while you wait. Stroke affects the brain, and the brain controls everything: balance, speech, even how you breathe. So your position matters. Don't try to walk around. Even if you feel okay, your balance could suddenly fail. A fall could worsen the situation or make treatment harder. Instead, lie down safely. Choose your side, whichever is more comfortable. Bend your top leg slightly for support. Use your bottom arm or a pillow under your head. Face downward just slightly to keep your airway open. This is called the recovery position. It's used worldwide to prevent choking and keep breathing steady. If you're able, elevate your head with a pillow or rolled up towel. That small lift may ease pressure on your brain. Don't eat or drink anything no matter how thirsty you feel. Your swallowing reflex might be impaired and choking is a serious risk. Also, some stroke medications can't be given if you've recently eaten. Loosen tight clothes, collars, belts, waistbands. Allow your body to breathe. Manage temperature. Cover up if you're cold. Crack a window if you're hot. Strokes can interfere with body temperature control, so small adjustments help. And above all, stay calm. Yes, it's terrifying. But panic raises blood pressure, and that can make things worse. Breathe in through your nose, out through your mouth, and say to yourself, I'm doing everything right. Help is coming. I'm going to get through this. The final step is one that many overlook, but it can directly impact your survival. Track what's happening to you. Time is brain. Doctors need to know exactly when your stroke symptoms began to determine what treatment you can receive. If you're able, record the following. When your symptoms started, what came first? Numbness, speech, trouble, dizziness, whether they've changed better, worse, or the same. Any medications you've taken in the last few hours, actions you've taken, lying down, unlocking the door, etc. Can't write. Use your phone's voice recorder. Say it's 7:22 p.m. I just lost strength in my right arm. Calling 911 now. Even a 10-second voice memo could guide your emergency care. If you can set a repeating alarm on your phone every 5 or 10 minutes, it keeps you alert and might draw attention if you lose consciousness. These tiny details help doctors decide quickly and give you the best chance of full recovery. You don't have to be helpless. Even in the scariest moment, you have power. You have knowledge. You have a plan. Recognize the signs. Call for help. Prepare your space. Protect your body. Track your symptoms. These 5 steps aren't just tips, they are a lifeline. So here's our question for you. Have you ever experienced a stroke or known someone who did while alone? What did you learn from it? What would you do differently now? Please share your thoughts in the comments. Your story might save someone's life. And if you found this video helpful, please consider subscribing to our channel. We're here to help you stay informed, empowered, and independent at any age. Thank you for watching. Stay safe, stay prepared, and take care of yourself. Because you matter.